everyone. I'm Dr. Stephanie Reznick. I'm a board-certified internist and one of the medical directors for virtual primary care here at Oscar. I've been hearing a lot of questions about who could become a long hauler or what is post-COVID-19 syndrome and the like. I'd like to answer some of those questions now. The first one is who could be affected by post-COVID syndrome or become a long hauler? And the answer is really anyone who's had a COVID-19 infection. Whether you're young or old, healthy or not, had a very mild or even asymptomatic infection, or had a severe infection and were in the intensive care unit, regardless if you've had the infection, you could potentially develop post-COVID syndrome. In fact, one recent study showed that 19% of those who had asymptomatic COVID-19 infections later went on to develop at least one symptom of post-COVID syndrome. So that begs the question, what is post-COVID syndrome? Well, there's not one standardized definition currently, but essentially it's a group of symptoms that happen after a COVID-19 infection. The symptoms can be varied. Most commonly, we're seeing symptoms of fatigue, shortness of breath, or coughing, but it's not limited to that. We're seeing some patients who are having dizziness, others are having odd skin rashes, some are developing autoimmune conditions. It really can be almost anything. And that's what makes it hard to diagnose. Additionally, a lot of the symptoms are what we call nonspecific, meaning a lot of different things could cause it. For example, a lot of different things can cause people to feel fatigued. And this makes it that much harder to figure out that the patient has their symptoms as part of post-COVID syndrome. The next question I often get is, well, why is it so hard to treat and diagnose? Well, I already addressed the challenges about the symptoms. And then the fact that you can develop it after having an asymptomatic infection also makes it challenging. You might not even realize you had the infection that would put you at risk for developing this. Additionally, medical community doesn't really understand why or how people develop post-COVID syndrome, and that makes it really hard to treat. We don't know how to intervene. That said, there are still treatments available, mostly focused on symptom control. For example, if someone's feeling fatigued or weak, undergoing physical therapy or endurance training can be helpful. All this said, the medical communities around the world are studying very hard to figure this out, and I expect there to be updated information regarding diagnosis and treatment coming out, hopefully soon. This will be an area that is evolving quickly. So what should you do if you think you might be a long hauler or have post-COVID syndrome? Well, if you're an Oscar member, reach out to the virtual primary care team if you're a patient there, or otherwise the virtual urgent care team, which is available 24/7. You can also reach out to your primary care provider who can take next steps in figuring out what's going on and how to best help you. Thanks for listening, and I'll see you next time.